Ready? All right, so this is going to be a walkthrough of our cadaver heart. And what we see right here is the anterior surface. This is the part that faces the sternum. So if you were facing someone, this is the view of the heart that is facing you. But let's orient ourselves so that we know that, because you would not be told that on an exam. So this is, like I said, a human heart. It's a little larger than normal. Normally the heart is just a little bit bigger than the closed fist, and this is from a rather petite 90-something-year-old female. So this is a little bit bigger than we expect, but that's good because it makes the structures that we want to see kind of stand out. So how do we orient ourselves? Well, first, in a human heart, it has a flat spot here that sits on the diaphragm, so that's how it's able to sit up so well. So that part is what would be sitting on the diaphragm, now sitting on the dissecting tray. Part of it comes to a somewhat of a point right here. It's a little blunt, but it comes to a point that's called the apex of the heart, and that points roughly towards your left hip. So this is the kind of inferior point of the heart. Up at the other side, we have some blood vessels. This is the aorta, which we'll see in just a minute, and in front of it is the pulmonary trunk. So this is the top or the superior portion of the heart. And here, if we flip it over to the back, there's a lot of vasculature on the back of the heart. So we know that this is the posterior side. So now that we've oriented ourselves, what can we see in this view of the heart? Well, first, there is this vessel right here. This is the coronary artery. And then that is what separates the right side of the heart and the left side of the heart. It does not run straight up and down left and right, but it does kind of run diagonal, so that everything kind of diagonally in this direction is the right side of the heart, and everything diagonally in this side of the direction is the left side of the heart. So now up at the top, at the superior part of the heart, we have these little flaps right here, one on this side and another on this side. These are called the auricles, but more importantly is what's inside the auricles. This is where we would find the atria of the heart. So here is the right auricle, so inside is the right atrium. On the other side, here is the left auricle, so inside is the left atrium. But the majority of the bulk of the heart, this is where we find the ventricles. So again, go back to that coronary artery. Over here would be the right ventricle, and over here would be the left ventricle. Now coming up to the top, to the superior part of the heart, this large vessel right here, this is the largest vessel in the body. This is the aorta, and just in front of that, slightly beneath, this is the pulmonary trunk. And here we can see this is still part of the pulmonary trunk. It's very soft. It doesn't have a lot of pressure, so it's not nearly as dense as the aorta. Now, if we flip the heart over, now this is the left side of the heart. This is the right side of the heart. We can see inside all of the chambers. So first, let's start at the top. At the top of the heart, the superior part of the heart, this is where we find the atria, the receiving chambers of the heart. So on this side, this is the left atrium. If we look inside downward, we can see this valve right here. This is the left AV valve, or the mitral valve, or the bicuspid valve. If we open up the right atrium and look down inside, this would be the right AV valve, or the tricuspid valve. We can see when we look at the walls of the atria, they're not very thick at all. They are receiving chambers. They're not responsible for pumping blood, so they don't need to be very thick. But if we go downward to the right ventricle, we can see that it's quite a bit thicker. This is pumping blood. It's pumping blood to the lungs, which are right next door. So even though it's thick, it's not incredibly thick because the lungs are so close it doesn't need to be thick. Compare that to the wall of the left ventricle, which is much thicker because it has to pump blood all through the body down to the feet and back. So the left ventricle is much thicker. That's another way to orient yourself. Now, inside both of the ventricles, we can see things like these strings right here. These are called chordae tendineae. They attach to the valves of the heart. They aid in opening the valves as well as keeping the valves from closing too far and reflecting the other way. At the end of the chordae tendineae, there are small bumps of muscle. These are called papillary muscle. And the papillary muscle helps to anchor and to pull as the heart contracts. It pulls on those chordae tendineae. Now, if we look upward between the walls of, between the ventricle and the aorta, we can see where the connection is, and this is where that valve would be. Same thing on the other side. This is where the valve would be. But if we go back to the vessels at the top of the heart, again, let's orient ourselves. Here is the aorta and the pulmonary trunk. These are the two vessels that leave the ventricles. I have dissected open the aorta to see down inside of it, and if you look down inside, there is a valve there, and that valve is what is between the left ventricle and the aorta, so that is the aortic semilunar valve. On the pulmonary trunk, it's a little harder to see, but down inside is another valve, and that valve is the pulmonary semilunar valve. It is between the pulmonary trunk and the right ventricle. One thing that you could do is push your finger into these vessels and see where does it come out. Well, if I flip around to the right ventricle and I push my finger through the pulmonary trunk, it will come out inside. I don't know if it's going to be visible. My finger is not, the left ventricle. If it's coming through down here, you might be able to see a little bit of the valve stuck to my finger. With the aorta, it's a little bit too long. I'm going to try to put the probe through and see if it comes through right there. We can see the valve sticking to the edge of the probe. Now, what other vessels can we see? There's a lot on the back of the heart, and this is where knowing path of blood comes in handy. If we know that this is the right atrium, well, look to see what goes into the right atrium. There are two vessels that go into the right atrium. This one, my finger is right there, and this one at the bottom that my finger is in. So both of these vessels enter the right atrium. What vessels enter the right atrium? Well, that's the vena cava. Here at the top, at the superior side of the heart, this is the superior vena cava, returning blood from the upper part of the body. And here is the inferior vena cava, returning blood from the lower part of the body. Over on the other side, the left atrium, here we have two vessels entering the left atrium. Over here on the right side, coming back from the right lung. Over here on the left side, coming back from the left lung. So these are the pulmonary veins, the right pulmonary vein and the left pulmonary vein. So on the human heart, that is everything you need to know.